Yeah, welcome to once again another session with Dr. Fresh, and today we're doing the part 2 of risk factors for breast cancer. So this part 2, we want to talk about modifiable risk factors and non-modifiable risk factors. Modifiable risk factors are risk factors that you can work on, you can change, you can do something about. Non-modifiable risk factors are risk factors that you can do absolutely nothing about. So what are the modifiable risk factors for breast cancer? So number 1 is obesity and overweight. It's been shown that people who have breast cancer, majority of them are either overweight or obese. So the better a person's weight, as regards the BMI, the body mass index, that is weight in relation to height, the less chances they can come down with cancer. Number 2, modifiable risk factors. You have inactivity. So if you do not do anything, you live a sedentary life, you are at higher risk. Why? Because you will gain weight. With time, you may become overweight and obese, and then you could come down with cancer because you are at a higher risk. So, if you're somebody that you live a sedentary life, try to do things that keeps your life going, that makes you probably a bit more active. Number 3, excessive intake of alcohol. It's been shown that ladies who come down with cancer, some of them have a long-term history of excessive alcohol intake. And if you smoke, as a woman, you smoke cigarettes, you smoke shisha, you smoke you have just increased your risk of cancer by 4 times if you do smoke. So smoking is an indication for a long-term possibility of a malignancy. So we've talked about excessive weight, overweight, obesity. We've talked about a sedentary lifestyle. We've talked about excessive alcohol intake, number 3. Number 4, we've talked about smoking. Now, it's important for you to know that there are people who are exposed to certain chemicals called diethylstilbestrol. If you are exposed to this chemical, you can come down with cancer. It was a chemical that was excessively used in time past. People who came in contact with this chemical, they came down with cancer. More importantly, if you are a person on hormone replacement therapy, perhaps you want to look more beautiful, you want to retain your youthfulness, you're on estrogen supplementation, estrogen replacement therapy, you could likely come down with a breast cancer. What are the non-modifiable risk factors? Number 1, we have someone that has a dense breast on mammogram. Mammogram is recommended for women above 35 years. It's more like an X-ray of the breast. If you do an X-ray of the breast, which is the mammogram, and it shows dense breast tissue, it's a high risk that the person will come down with breast cancer. Number 2, if you have had a cancer in the past, you're a cancer survivor, it puts you at a risk of a cancer. Number 3, if you are somebody that you have had a breast lump, a repeated lumpectomy, and they had to remove the lump over and over again, that is a clear-cut indication of a possibility of a cancer in the future. So please, this information is for you to modify your life and do better so that you could escape this menace that have befallen a human race called cancer. I wish you the very best as you adhere and live your life to evade all the necessary or the possible risk factors that you're possibly exposed to in your immediate environment. I wish you the very best and subscribe. Remember, if you know better, you will do better. Cheers.